Hi, I'm Dr. Paul Fisher with Gold Coast Chiropractic, and today I want to talk about Arnold Chiari malformations. Now, if you're not familiar with an Arnold Chiari malformation, what that is when a part of the cerebellum, which is part of your brain in the back here that helps control balance and coordination, when that will actually go below this hole in the base of your skull called the foramen magnum. It herniates. Depending on how much of the cerebellum goes through that hole, it can be an Arnold Chiari type 1, type 2, type 3, and type 4. In chiropractic, we more or less see the type 1 and the type 2 kinds. There are some that show up because patients have had long-standing headaches. They've been able to get no real answer for what's going on with them, and this is shown during an MRI. There's another where patients have been in a car crash or had some traumatic event, and MRI will show it's there too. Now, there is some discussion back and forth about whether or not the Arnold Chiari malformation was there before the crash or the trauma, or if it was a result of the trauma. But it's not really an issue that we look into too deeply, because if it's causing clinical symptoms, that's where we really start focusing. Now, there are surgical treatments for this, because what happens when that cerebellum starts going through that hole, it can put pressure on it and the body doesn't work the way it's supposed to. Effectively, the surgeon will just remove a piece of the skull there to take pressure off of it. This is done in obviously more extreme situations, but sometimes this is even done in fairly minor instances to give the patient relief. Now, in chiropractic, what we focus on a lot is we see the correlation between the lack of a normal curve in the neck and then that. That's really, if I see that on a film and I know a patient has this, that to me says that, hey, there's a good chance that we may be able to help them. Now, the reason that is because when you have a normal curve in your neck, your spinal cord and brainstem, there's less stress, there's less of a pull. Think of this almost like a bow and arrow. When you lose that curve, it pulls tighter and tighter on the string part of what would be the bow and arrow, and can add to that herniation of the cerebellum going down into the foramen magnum. So as a chiropractor, what we work on here is improving the curve in the neck to take the pressure off of the brainstem, off of the spinal cord. Ideally, what this does is allow things to rest up where they're supposed to be, take pressure off the cerebellum, improve our patient's symptoms. Because in some patients, this can cause a whole myriad host of issues beyond just headaches, but like I said, balance issues, coordination issues. There are some patients that just have very kind of unknown symptoms that are just, they'll feel vibration on one side of their body, or things, just all sorts of honestly kind of strange things can happen where they'll feel like they're cold in one part or hot. And you just get a number of odd and sometimes unrelated symptoms that can be really tough to diagnose. And this can be very frustrating for patients, is because there's no easy answer to what's going on. So sometimes they're told that, these symptoms can't be happening, or they're making them up. What we find a lot is that because of that added stress on the spinal cord, your brain does all sorts of things, and especially right at the brainstem, there's a lot of very important things that happen there. And when things don't operate the way they're supposed to, you can get all kinds of odd symptoms. I'm Dr. Paul Fisher with Gold Coast Chiropractic. If you or someone you know is suffering from Arnold Chiari malformation and you'd like a non-surgical option, please call our office. I'd love to see if we can help. Thank you, and have a nice day.